All right, class. Time to talk about a drug that's very near and dear to my heart as a diabetic. Definitely, this is one you gotta know all the goods and the bads about. So, of course, we're talking about D50 or Dextrose 50%. Again, a great drug when used properly, and we're going to talk about some of the variations of using this particular drug. I'm gonna move myself over here because I didn't realize that it was there we go. So again, D50 dextrose is what we call it, and again, it's used to treat hypoglycemic patients, someone with a sugar usually below 60 milligrams per deciliter. They have symptoms such as loss of consciousness. Again, if their sugar is low, your body requires the glucose for fuel, and dextrose is easily converted into glucose and turned into our body. It's a carbohydrate. It is a hypertonic solution, and it is a hyperglycemic as far as classification of drug. Again, it is very hypertonic, by the way. I want to stress that, and we'll talk about that here in just a minute. It elevates blood sugar. Again, it's simply long and short of it. It provides a little bit of diuresis, and that's usually because you overwhelm the body with sugar, and therefore the kidneys think I got to get rid of it quick. So that's how it kind of works. Again, usually less than 1 minute. However, I'm going to put a caveat on that. There have been some times I've given it to patients and it would take maybe 20 to 30 minutes to actually fully kick in. If their bodies get used to getting this material, sometimes, especially your older diabetics, might take a little bit longer. And the duration kind of depends on how bad their hypoglycemia is, how much the stores that they have on board. So again, it kind of depends. I can tell you, kind of a rule of thumb is about 15 minutes, but but again, it depends on the individual. Some people, you hit them with a half a amp of D50, and their blood sugar goes from 60 to 300 and stays there for a couple hours. Somebody like my size usually give it to me 45 minutes later. I've worn it off. And it also depends on how much insulin that they have taken. So usually when you're giving this to a diabetic patient, you really need to find out once they become awake and alert oriented when they took their insulin last, and again what type of insulin they took. Your shorter actor insulins, again, they react pretty quick, but if they've taken a longer acting insulin, they're going to need additional carbohydrate stores in order to keep their blood sugar up. So again, we use it for hyperglycemia. If they've overdosed on insulin, this is usually the reason that we end up getting called. They haven't eaten if they're taking insulin via shot and they haven't eaten. It's a terrible thing to do. You absolutely, and then you got to make sure that they eat something after that. And then altermentation, when we don't know what their blood sugar is and we can't easily obtain it. And I want to, again, this is kind of an old school thing. When you had somebody that was unconscious, you didn't know why. Guys, most everybody has a blood glucose meter now, and a blood glucose can get a blood glucose very easy. Most ambulances has 2 to 3 glucometers on it. There is no excuse for giving somebody sugar when they don't need it. You can make other problems worse by doing that, especially if they are unconscious or have altermentation due to a brain bleed and you decide you're going to blast them with sugar. Very detrimental effect, and we'll talk about this here in just a second. All right, some side effects, again, can cause neurologic symptoms. It can cause that Wernicke syndrome in your malnourished and your diabetic patients. Again, we usually give thiamine with it to prevent that. Again, you can get high blood pressure, congestive heart failure by pushing this, usually because you push it too fast and you give them too much. If you give this in a peripheral vein, it can cause hardening, especially if you've done it multiple times. If you go to the same diabetic 3 to 4 times a week to give them this sugar, guys, it's very hard on the veins. A matter of fact, and we'll talk about it when we get to the preparations, some different things that you can do to help kind of prevent that. It can either cause acidosis or alkalosis, and it usually is going to cause hyperglycemia. the times that I have had it is taken my sugar from, let's say, a 40 or a 50 up to around the 300 range and getting that back down. So again, blasting with too much sugar is a bad thing. Hypokalemia, it can drop your potassium, and it can cause a little bit of rhabdo, can cause some kidney problems. Again, the biggest thing though, and I have to stress this part about side effects, and you got to make sure that this thing is in a patent vein. Okay, it has to go into whatever you're giving it in, and you're giving an IV or IO, you got to make sure that that thing is in the right spot. I usually start 1,000 bag on these patients, and I run 200 to 300 cc's in before I give them the dextrose. And the reason being, I want to make sure that that IV is a patent IV. I want to make sure it's in there. Okay? And it is so very important. Matter of fact, ask AMR about Miss Texas losing a 7-digit lawsuit to her because their paramedic pushed D50 through a non-patent vein into the subcutaneous tissue. She ended up losing the arm, okay? So I will tell you that, again, it can happen. Make sure that it is in a vein. I can't stress that enough. Again, if they have any type of intracranial or interspinal hemorrhage, stay away from glucose, okay? And again, you can glucagon them. You can use oral glucose on those folks. But I will also tell you this, staying a sugar below 60 doesn't help those things. But if you give that to an intracranial bleed, you're going to get and cause tissue necrosis, okay? If you have somebody that you think is having a stroke, get their sugar just above 60. And I mean, I'm talking maybe 5 grams of it. Maybe instead of all 50 milliliters of there, you only push maybe 5 and see if that gets the sugar up. Blasting those folks with sugars can cause some very serious problems, okay? If they're having DTs, again, if they have dehydration, don't be slamming a bunch of D50 on them. And then again, your blood glucose level that is greater than 60, that's when you want, it's not a, it kind of depends. I've had diabetics, though, with their normal blood sugar being 200, because they didn't manage their diabetes well. And again, when they got down to the 80 or 90, they would be showing signs of hypoglycemia. So don't be afraid to maybe give them a little bit to get the sugar level up to stop the symptomology. Usually cumin or warfarin, it loves to clot, it likes to crystallize. So don't get those drugs with that. Again, make sure you get a blood sample before. Make sure you get a D-stick ahead of time. Use the largest vein possible. The bigger the vein, the better, okay? And you can complicate a lot of medical conditions by giving D50. Stroke especially, we've already talked about it. But you could also make a heart attack worse by blasting them with too much sugar. If you will not want to put this outside of a vein, you're going to kill tissue, okay? If it does happen, immediately stop the administration. This stuff is very thick, so the tendency is to push it hard. Bad thing to do, okay? And run that IV wide open and aspirate on the syringe to make sure that you've got a good patency in there, okay? Thiamine should be administered before D50 for an alcoholic patient. You need to have the thiamine on board to help process the glucose, okay? So, again, thiamine is a good thing to give ahead of time. And even if you forget, if you do it afterwards, it's not necessarily a bad thing. So, again, but you need to give this, especially your malnourished, your patients, your alcoholics, those that are doing chemotherapy, specialized diets. Again, you want to give the thiamine so that it helps process the glucose, okay? You can actually send them into seizures if you do not do that little step. We are used to the big blue box is what we're used to. 25 grams and 50 milliliters, okay? Folks, let me just tell you, that has kind of gone out of favor, and what you're actually seeing now is they're actually putting bags of D10, 250 milliliters of D10 on the truck. By the way, 250 milliliters of D10 is 25 grams of glucose, okay? So, a matter of fact, when I give it, I actually prefer giving the D10, because if I have a problem, not giving as concentrated a sugar amount. Okay, now D25, again, they usually provide 12.5 grams and 50 mLs of D25. But we usually end up nowadays making our own D25, and we're going to get to that in just a second. Again, our adult dose is usually 25 grams. As a matter of fact, a lot of the protocols now, guys, have switched that to actually only giving a half a tube or 12.5 grams and then reevaluate. And when I do it, that's exactly what I do. I give 12.5 grams, I stop, I check their sugar again. If their sugar is above 180, I don't need to give any more. Now, the reason I say the 180 number, remember, this stuff wears off pretty fast, okay? But at that point, hopefully you've got them awake, talking, and we can get some better carbohydrates into their system that's going to be a little bit longer lasting. Your pediatric dose is usually 0.5 to 1 gram per kilogram. And we use D25 in kids, okay? The reason we use D25 in kids is that their little veins can't handle that D50. And truth be known, we need to be using that in our patients. When any patient, truth be known, we need to weaken out. D10 again is a better choice for us to use if you have the bag of D10. If you are doing this to a neonate, absolutely you got to use D10. So your agency decides to only buy you D50. All right, that's not a problem. We can make our own. To make D25, you take a flush and you push out 5 cc's, and then you draw up 5 cc's of D50. You now have 2.5 grams of D10. Okay, now, D25. You got that at D25. If you need to make D10, and this is the way I always did it when I was on the trucks, what I would do is I would squirt out 2 cc's out of a flush, and then I would draw up 2 cc's. That gives me a 4-to-1 mixture. So what I have is 1 gram per every flush. Usually for your neonatal patients, they're 3 to 4 grams. Usually they're 3 to 4 grams is what they are. So you don't need 3 to 4 kilograms. I'm sorry. You're going to give that, and you're going to give it again really slow. Because again, their little fragile veins are very tough. They'll rupture very quickly. They're not very tough. So again, you want to use a really dilute solution, okay, of this. So again, to make D25, it's a 1-to-1 ratio. To make D10, it's a 4-to-1 ratio. Again, make sure that you mix well with those, okay. We can give it IV and IO. We do not give it the following ways. We do not give it subcutaneously. We do not give it intramuscularly. We do not give it down the endotracheal tube. Those are absolute no-nos, okay? This stuff is, again, hypertonic, and it's basically sugar. So imagine, and I've had the horror stories of, the paramedic pushing D50 down the tube. Well, pretty much you've just crystallized the lungs. Way to go. Again, IV, IO only. And then, again, your pregnancy class, I've given it to pregnant patients. I have never had a bad adverse reaction. Maybe the worst case scenario you might have is that you can hyperglycemic the baby. But again, usually the baby can recover pretty quick. And there's still the placental barrier to cross, so you're usually okay with that. All right, that's it for the D50. Again, I much prefer giving a smaller amount, half of the bag, whether it be D25, D10. Give them half, see what happens. 12.5 grams first. And again, using that less concentrated solution, D10, is perfectly fine to use, folks. Again, the D50 is very viscous. It's very hard to push. You really got to make sure you got a big vein. By the way, once I do give it, I flush it with 200 to 300 more cc's of normal saline. So that's why I hang a big bag with those. So make sure you do those things. You're going to cause less damage to the patient, and they're going to be a lot better. All right, we're going to see you on the next one. See ya.